major risk. Okay. And then breast cancer remains throughout. It actually goes down quite a bit. Okay, here. Okay, lung cancer. Let's have a brief overview of lung cancer. It's number one cancer death for both men and women. 60% of people die within 1 year of diagnosis. Lung cancer is a disease that, if found very early, it could be treated or cured. Unfortunately, the lung is such a big organ. Usually, if there's something small that is growing inside, you would have no symptoms. You will feel well. You will have no problem at all, just like a normal healthy person. Until one day, suddenly you feel like you couldn't breathe. Something is not right. You keep wheezing, and then you go to the doctors, and they do a chest X-ray or do a CAT scan and find out you have this big old lung tumor. Okay, so that's kind of unfortunate. Up until this point, there's still no guidelines or recommendation for lung screening, for lung cancer screening. They don't recommend people to go to their doctor's office and have a screening every year just to check it out, because one of the things is it's not very effective. Another thing is, in order to do that, you have to expose to radiation, unnecessary. Okay, so for that reason, they do not recommend people going to the doctor's office to have the cancer screening for the lung checkup every year, unless that patient has some sort of a clinical symptoms that would require that. Okay. So again, smoking is one of the major risk factors. Asbestos, the construction material inside the building, in a lot of the old building, I think they banned it now, but a lot of the old building, like this one, they still have some asbestos inside. Family history, radiation, industrial chemicals, and for the last 5-10 years, there have been advancement in molecular genetic study. So now they know that there are specific gene mutations that are related to lung cancer. Okay, I wanted to mention here too is majority of the lung cancer case in the past occur in men, particularly older men that have smoking history. But within the last 10 years, there are several studies published of a very specific group. Younger, they're women, they're non-smoker, okay, that are presented with lung cancer. And one of the reasons that they could study from this group is those women have several risk factors. One of the risk factors is secondhand smoke, okay, and for some of the Asian country or the Southeast Asian country, they related that women cancer those risk factors into their cooking, the kitchen, that they were inhaling all this fume when they're cooking in the kitchen. Okay, that was one of the risk factors presented for this group. And then one of the things that is most importantly is this specific group of women have a gene mutation, okay, that is found in the younger generation, that non-smoker. Mm-hmm. But the type of cancer that they presented is different than the kind of cancer that presented in this men that have smoking history. Okay, so lung cancer is a general term that we say lung cancer. There are a lot of different types depending on the tissue. There are squamous cell cancer, there are adenocarcinoma, there are bronchial alveolar carcinoma, different type, and there are small cell carcinoma. Okay, so those are the subtype, and they all being treated differently. They all have chemotherapy drug and that are different. Okay, so this is a picture that I found when I Googled it. In the non-smoker's lung, it's usually a healthy kind of a pinkish tan color. Okay, here's a heart. And this is the smoker's lung that is have all this nicotine and ashes deposit. Okay, pigment, black. Okay, here is a gross specimen. We call it gross specimen. After they surgically remove it, the specimen itself we call it gross specimen. I think it's probably the term. Okay, so this is a normal lung tissue. Here is the tumor. Okay, and this is the trachea. See how big the tumor is? Okay, so it's almost is growing and it's pushing into the trachea. So what happens if there's something growing that is pushing into your trachea, your windpipe?
Makes it harder to
Difficulty to breathe, right? So those are the time when people say, oh, I have difficulty breathing, and they show up to the doctor's office, and then they found out that there's this big, gigantic tumor. Okay, so what are the kind of cells present in the lung? Normal lung. This is what we call the bronchial cells. They are columnar shaped. Okay, they are tall columnar form. They have a very nice kind of a round oval shaped nucleus. Each one of them look very similar to each other. Okay, and see this kind of little pinkish cilia on top? It has a very important function. Okay, this little cilia inside the lung in the body, when they're alive, of course now they're not alive, they're already fixed and thing. But when they're alive in the person's body, the little cilia have the function going like this back and forth, cleaning up, sweeping away all the dust and pollution that you breathe in. Okay, there are millions and millions of those cells in your body, and they're constantly doing this kind of thing, trying to get rid of the pollutant, the chemical, or whatever that you breathe in. And here, these are the different kind of cells that we call macrophages or histiocytes. Okay, they are the what's so-called garbage cleaner in the lung. So all those little contaminant particles, dust particles that this kind of cells that is swept by, all these histiocytes and macrophages will go around and clean up all those stuff. Okay, so that you maintain a very clean environment. And see this kind of little black thing all over? Those are all the dust particles and pollutants that the cells clean up. Okay, what they do is they have the ability to absorb all those pollutant and chemical in the body, or all this dust thing in the lung that is being swept up by the bronchial cells, and they disintegrated it, okay, into the body and then release it. All right. However, when a smoker enters the long-term inhaling the pollutant or cigarette or chemical or industrial environment, the cells will lose the cilia. It will no longer present. And if they present, it will be in a very small number. So there's a decreased function of the normal cells. The cells will still be here, but they all lose this ability to have the cilia. The cilia are no longer there. Okay, and if they're there, they're not doing as good at this job. All right. Here's another look of the cells. This one is a big bronchial cells. So these are all normal. Okay, so this is a specific type of cancer that related to smoking, and is seen almost exclusively from smokers. Okay, this is called squamous cell cancer. I can see, I can't even point out a normal cell in this picture. This is probably one of the normal cell here, but everything else is not normal. Okay, look at how funny the shape, the cells. This is the nucleus. This is a nucleus. This is a nucleus. This is a nucleus. This is a nucleus. But compared to the previous picture, how the cells are all lined up normally and very uniform looking, this looking very chaotic. Okay, they are all over the place. And these are the neutrophils. They are the white cells in the background. Okay, trying to fight off all this thing that's going on, all this disease. But unfortunately, this is going to be a lost battle. Okay, so this is what we call the squamous cell cancer of the lung. Okay, and besides cancers, there's oftentimes there are infection in the lung when you breathe in mold, bacteria, things like that. Then it could grow in the lung. So tuberculosis, that is very commonly seen in the developing country, and in Asia, it's not as common seen here because it's well under control. Okay, however, this is a chest X-ray. Okay, this is the scapula. All right. The clavicle, and this is your spinal cord, your ribs, and this is the lung. that you can see. But see this kind of a white patchy area? If this were a normal lung, it should be all very clear and just black with the ribs, okay? But you see this kind of a white patchy area here. So there's something going on here. And under the microscope, we can actually see the little bacteria. So this is a cell with the nucleus, okay? These are the red cells. But see this kind of a whitish little squiggly thing? Those are mycobacteria. Okay. There are different kinds of lung infections. Herpes virus could also occur in the lungs. Okay. And then Candida infection, yeast infection could also occur in the lung. So all those are being treated with different kind of drugs. And we could all see it under the microscope. Okay, breast cancer is the most common cancer among women in the Western society, like Europe, US, and Canada. However, in the developing country or Asia, Africa, South America, all those areas, breast cancer was not the top thing. Cervical cancer was more common. Okay. Second leading cause of death, routine self-exam and mammogram is very important. So mammogram recommendation is to start it when the patient reach age 40. Okay, but for breast self-exam, when you go to the physician for checkup every year, do they teach you breast self-exam? They should. Okay, so probably next time when you go, it's a good idea. Do you go for a physical checkup every year, right? Okay, so you need to ask your doctor to teach you how to do the breast self-examination. Okay, like I said before, nobody knows your body better than yourself. So it's better to know it and see if there's any kind of changes, you detect it earlier. 70% of the cases of breast cancer, over half of those cases, the patient discovered first. They found something on their breast when there's like, oh, there's something, a lump here. They go to the doctor, and the doctor order the test for them to do the mammogram. So it's very important to learn how to do the breast self-exam. Okay. Risk factors, usually one of the risk factors is age and family history. Genes mutation is one of the big things. Angelina Jolie, right? That's her name, the famous movie star. She has the gene mutation, the BRCA gene mutation of the breast cancer. That means that she has a higher chance of developing breast cancer. Risk factors, meaning that in this category, they increase the person's general risk of developing the cancer. It's not that the person is going to have cancer for sure, no. It's just that they have a higher chance to get the cancer. Okay, that's what it means. Using endogenous hormonal therapy, that including birth control pills. Okay, normal breast tissue, normal breast cells, what we call ductal cells. Benign meaning normal. Okay, that's the word means, benign, normal. Okay, so when the cells are normal, look at how nice and uniform the shape and the size. They all look very similar to each other. Okay, they look very uniform, even distribution. They're not pushing into each other. They're about the same size, the same shape. Okay, here again, and what they presented almost like a honeycomb pattern, what we call the honeycomb pattern. Okay, they all have a round nucleus. Okay, have a little bit of a granular cytoplasm surrounding in the ductal form. Okay. So this is abnormal cells, ductal carcinoma of the breast. And on the mammogram, here, the fatty tissue is the black. Okay, on mammogram when you look at it. Usually the fatty tissue is the black. This is the nipple area, this is the fatty tissue. And some of this area here, the ductal lining cells, all this ductal lining cells, this kind of a little white line. But obviously, you see there's something forming right here. Okay, so this is not normal. This should not be here. On a normal breast, you should only see the fatty tissue and all this little like spider web kind of white line that is the ductal epithelium. However, when something is growing like this, that's not normal. And this is a picture of ductal carcinoma, the abnormal cells. The cells changing from the uniform round shape in a flat sheet to a more crowded, clustering kind of formation, okay? And if you look at the nucleus of the cells too, do they look similar to each other? No, they look very different from each other, very irregular shape, okay, what we call. You can see that this one almost like a moon shape here, okay? And this one is a big round one, and this one is almost like a potato kind of a shape, okay? So this is not normal. Okay. Sometimes we found cells that have funny looks and then we take pictures of it. Okay. So I think that's a neutrophils. Okay, cervical cancer. Okay, cervical cancer is one of the most common cancer in women worldwide. Okay. Thanks to Dr. Papanikolaou and the Pap test here, in the US and the Western society, there have been a significant reduction of cases, in the last 30, 40 years. However, a lot of the other countries still do not have what they call the cancer screening system, okay, particularly for cervical cancer. Here, for the guideline in the US, up until 5 years ago, the guideline was all the women, when they start sexual activity, then they should go to the doctor's office checkup every year and have a pap smear taken, okay, to screen for cervical cancer. That was the guideline up until 5 years ago. But now, the guidelines have changed to every 3 years, okay? So the thing is, if a woman goes to the doctor's office for checkup, if she had 3 years in a row, the pap smear are normal, negative, nothing's wrong, then the next time she could go, it could be every other 3 years, okay? It doesn't have to be every year. However, if she had any abnormal history, she still needs to go every year, okay? So that's the current guideline. The number one major risk factor now that we've been proven was caused by this human papillomavirus infection, HPV infection, okay? That is the major cause of cervical cancer. It's not the only cause, but it's the major cause. There are other risk factors, including HIV, AIDS patient. They have a higher chance of contracting the virus. Smoking also adds to it, okay? Family history, multiple sex partners, including having sex at early age. Those are the risk factors that could increase the risk. Okay, HPV is a DNA virus infection. It's a sexually transmitted disease, okay? In today's society, HPV infection is actually a very common infection, okay? However, the problem with that is a lot of time it doesn't show up in the women's symptoms, okay? It doesn't have a lot of other signs and symptoms until it's like actually disease. So some people may have it walking around and not know about it, okay? So unprotected sex, sex at a young age, many sexual partners, they all increase the chance of having the HPV infection, okay? Currently, there's no cure for this infection, but there's a vaccine. However, once the person contracted HPV virus, the vaccine no longer works, okay? So that's why the recommendation now for the vaccine is for girls, start at age 12. Is it age 12 or 9? I believe. I think age 12.
I think it's 12.
Yeah, age 12. And then there is a controversial